I think we can start. A very warm welcome to all the participants from me. I'm Luciano. A very warm welcome from me. I'm Luciano Saso. I'm a professor of pharmacology at the Faculty of Pharmacy and Medicine of Sapienza, University of Rome. Today, we have a very interesting webinar to present the project opnMe by the company Boehringer Ingelheim. opnMe is a very interesting open science portal of this company that fosters independent innovation by sharing well-characterized preclinical molecules for free for research purposes with scientists around the globe. Researchers will own all rights generated with the molecules and are encouraged to publish independently in high-ranking scientific journals. In addition, scientists are invited to submit innovative research proposals to address pharmacological or technological questions. Some of them offer access to unprecedented and unpublished molecules from Boehringer's research pipeline. Furthermore, the recently launched Open to Talents program offers prestigious postdoc grant funding to pursue a professional career at one of the 3 research campuses in Germany, Austria, and the US. To talk about the project, we have 2 distinguished speakers today. We have Dr. Florian Montel. He grew up in the southeast of France and received his master's degree from the School of Chemistry of Montpellier in 2001. Then he obtained his PhD at Sanofi Aventis in 2005 under the supervision of a professor from Paris 6 University, which now is called actually Sorbonne Université. And then he joined Novartis in Basel in 2005 for a postdoctoral position. And then he continued his careers for about 8 years at UCB in Belgium, being project leader of CNS projects related to epilepsy, cognition, pain, etc. Then since 2017, he's leading the opnMe initiative and was appointed head of the Open Science Group of Boehringer Ingelheim in 2022, overseeing most of the open innovation initiatives of the company, from the opnMe website to the coordination of the public-private partnership funded under the IHI. Another distinguished speaker we have today is Dr. Markus Köster. He's a healthcare professional with more than 20 years experience in biotech and pharmaceutical industry sector with an education in molecular biology. He has joined Boehringer Ingelheim 11 years ago as Director of Discovery Research Coordination. In his current role, he co-leads Boehringer Ingelheim's Open Science, Open Innovation Portal, opnMe. As such, Markus was deeply involved in the concept development and positioning of opnMe towards scientists and researchers across the globe. 6 years later, opnMe has proven to be a major success for the company, with more than 5,000 registered portal users from 72 countries, more than 2,000 individual molecule orders, and 1,800 research collaboration proposals. Beyond opnMe, Markus has a substantial experience in other open innovation formats and projects. Before the era of open innovation, Markus gained substantial experience in different roles, covering both research as well as marketing within Boehringer Ingelheim, Merck, and 2 biotech startup companies. So a very interesting webinar today, and we start with Florian. Please, the floor is yours.
Thank you, Luciano, and thank you for the very kind introduction. It's a pleasure to be invited to your very well-known and high reputation webinar here. It's a pleasure for Markus and for me to introduce today our initiative, opnMe.com. So opnMe is an open innovation website. So of course, you can immediately take your smartphone and type in your browser opnMe.com to visit our website. There is no registration needed, and you can have access to the entire website for free. So today, my objective with Markus is to show you the different initiatives we have on the portal. Let me try to change the slides properly. Yeah. So today we will discuss what is all opnMe. And how you can get benefit from the current programs we have on the website. We will, of course, touch also the impact of open science approach on research initiative within the scientific community. So I skip our introduction. Luciano did this very well. The website has been launched in 2017 by a team of crazy scientists, starting more or less from scratch. You can more or less see the first team behind this project on the screen. It was a beautiful adventure, you know, being in a pharma company to launch from scratch an open innovation initiative. opnMe today is 5 initiatives, 5 main pages on the website. You have the QR code on the top corner right of the page. I will introduce in more details molecule to order and molecule for collaboration. Marcus will introduce in more details open to expert and open to talents. Today, you will not see a presentation about TechMatch because this page is not yet launched. It will be launched in May this year. So we do not have slides about this topic, but just keep in touch with us and visit regularly the web page. You will see a new page appearing beginning of May about identification of new technology. So let me start by the 2 molecules initiative we have, and Marcus will focus on the crowdsourcing of question and talents in the second part of our presentation. So let's start with the molecule to order that we also name M2O. The basic idea and the basic concept of M2O is very simple. We have hundreds of compounds which are sleeping in the fridges of our company because of good or bad reasons. This project has been stopped. And the team, composed mainly at the beginning by chemists and biologists, decided to say that we can do something great out of it. And it's also very well known in the literature that a lot of experiments are failing because of the quality of the tool compound used by the team. So we decided to look in our collection of molecules and offer for free a collection of molecules that any researcher in the world can have access for free and without any IP strings attached. Let me show you a little bit how it looks like. Hop. Sorry. So today on the web page, if you visit the first page of molecule to order, you will see a list of 87 molecules with their negative control for most of them, and they are really 100% free of charge. So it means that you can go to any of the page, select 1 or 2 molecules or even more of interest for your research. You can place them in the shopping cart. And after registration, where you will only give us your address, your name, and the place we have to deliver the packet, you will get in less than 5 days the molecules on your bench. Of course, there is a small step in between where we check your affiliation because we need to make sure that there is a lab supporting your query. But except this very simple stage, everything is fluid and transparent, and you get immediately the compound to perform your research. You will get 5 milligrams of the active probe and 2 milligrams of the negative control. If you need more for performing in vivo experiment, for instance, you can always reach out to us via the contact us formula on the page, and we will discuss via email to see how we can satisfy your needs. Today, we cover more or less all type of mode of action and targets, from GPCR to kinases, and also membrane transporter or even epigenetic targets. All of these compounds are really available for free. So there is no cost hidden behind this page. We want you to have access to the best quality tool compound that we have developed at Boehringer. Being very clear, these molecules are preclinical tool compounds. They are not ready for human application, but most of them are ready for in vivo testing. Up to now, we have shipped more than 6,500 molecules across 52 countries. The main countries are the usual suspect, I would say, US, Germany, UK, Japan, and Italy. And we have quite a massive registration of biologists, mainly on the website. We have today more than 6,000 users or registered users on the platform. In average, we have 37, close to 40 compounds order per month, and we have in total shipped more than 2,000 orders. You can see below the split in terms of affiliation of our customers. It's obviously mainly university, but we have also research and government agencies and biotech register on our website, which are ordering our molecule. Sorry.
We lost you for a second. Maybe if you can repeat.
No, I was just waiting to change the slides by controlling the screen.
Okay, sorry.
So the website was launched in 2017, and we have published in Nature Review Drug Discovery relatively in details description of what this website is doing. You can always refer to this article if you want to have more details. Let me give you a little bit of background about what you can get on the platform. So clearly, the most active compounds, the most ordered compound on the website are the oncology ones. You can see here a few of these targets, which are really ordered a lot, and more than hundreds of times since the beginning of the website and since we launched them. So you have, for instance, KRAS, BCL6, or a Protax Mark2A4, which has been co-developed with the University of Dundee, or the MZ1, famous molecule from Alessio Ciulli and the Dundee University. So you can see that we have a lot of queries from these compounds, but we also get a lot of papers, articles published independently from us by the scientists who order this compound. And you can see the number with the small p at the bottom of the vial. Just to give you one flavor, the KRAS molecule, BI2852, generated 6 independent publications from researchers across the world. If you go to the website and you place in your shopping cart one of these molecules, you will have access to a full data package of information. So if you click below the structure and the chemical structure on the website, you can download a PDF where all the data we have at Boehringer Ingelheim associated to each molecule is given for free. You will have all the CMC properties, the PhysChem properties, the clearance and DMPK are all available, including the selectivity profile of the molecule, the potency, and see if we have the information. The in vivo PK and sometimes even the PD experiment is described in more details. So all of this is accessible without any registration, and it can help you to design best your next in vivo or in vitro experiment. You have below few examples of papers published the last years highlighting the success of this initiative. And I really encourage you to visit the website to have access to more details and search for your compounds and your target. If, and it probably will be the case, you cannot find a target which is of interest for you, you can always send us a small email via the Contact Us formula and ask if we have in our collection of compounds a tool compound for a given target. Always very happy to check that we have a molecule or not. It's a win-win situation. It will be one compound more for the website and one tool compound for you. The last molecule, the 87th that we place on the website is the BI5121. This compound is an orexin type 1 antagonist. This compound has been pushed live in March. And you can see here just a little bit of the communication effort that we do to promote this molecule on LinkedIn and other social media. The basic idea is really to promote the high quality of the compound and giving a lot of background information for you in order to perform the right experiment and publish a quite impactful paper. We also, thanks to this molecule, enter in contact with a lot of researchers across the world. And we have organized, in fact, very recently, last week, one of our first webinars for this year about one of our compounds and a beautiful success stories around it. We have shared now for quite a couple of years MMP13 antagonist, so a metalloprotease antagonist. And one of our colleagues was the moderator, John Ambor from Boehringer Ingelheim Bridgeville. And John moderated a webinar with two of our customers, so Laura Marie Zimmerman from the University of Köln and Deepa Ghosh from the Institute of Nanoscience in India. So both gave a lecture about the use of the MMP13 and the finding they had during their research phase about this compound and this target. Laura managed to get her PhD, and I think she managed to achieve a really beautiful PhD thanks to the access to this in vivo tool compound, which could really help her to validate her hypothesis and also publish a relatively nice article. Deepa worked in the direction of osteoarthritis in the joint, and she also, thanks to this compound and the support she got from opnMe and Boehringer Ingelheim, also a quite nice insight, new insight into the disease. You can see on the right a little bit of statistics about the attendance for this webinar. We are very happy to see, of course, a lot of US and Germany colleagues, but also a relatively nice panel of other countries. The recording will be available on the 4th of April, and you have here the QR code that you can just scan and follow to get access to the video. Let me switch gears. So after the presentation of the first pillar of opnMe, which is molecule to order, I will now introduce a second pillar about molecule, which is molecules for collaboration. Here, the basic principle is slightly different. Instead of offering for free a compound that we have in our collection, we would like to stimulate scientists to propose us new ideas to use a compound that we will offer to them. But this compound will be offered only via a collaboration agreement. The structure is not given, only a very limited information level is provided for the call, but we are expecting the scientists to provide us a very new idea and good idea to use this compound for a research proposal. Of course, these calls are launched in a completely different way than the others. For the first molecule to order, a new molecule is proposed every month on the platform. For molecule for collaboration, we have only one molecule every 3 to 4 months, depending on the pipeline we have. Up to now, we have launched 16 projects. You have here the extract of the target we have shared outside. We started 5 years ago, in fact, even 6 years ago with these calls. You can see that it's, of course, much more limited than the molecule to order, but it attracted really a lot of interest. We have collected up to now more than 1,100 research proposals to use one of these molecules. You can see that, again, here, the scope is relatively large. We have small molecule and few antibodies. We have shared single molecule, but also collection of molecules to address technological challenges like formulation problems. We have also shared via this kind of call our entire collection to promote screening of our entire collection. We cover all type of mechanism, including enzymes or even GPCR. The targets are relatively broad, and here we are totally agnostic in terms of disease. So it means that we are looking for the best proposal to use any of this compound. Of course, the fit with our strategy, the Boehringer strategy, is extremely important for the success, and the closer to our pipeline, the bigger the chance of success is. Nevertheless, we have a department which is named Research Beyond the Border, and our department is completely agnostic for the disease. So if your idea to treat a disease is extremely good, answering to a real patient need, there is also a chance that your project is considered for one of these compounds. So you can see that for each and individual call, we have a quite variety of number of proposals coming from only small 2-digit to sometimes 3 digits. And we can promise you a few things. First, all the proposals are read very carefully by a team of scientists. Here we are not doing business and development. We are really speaking about science. So all the proposals are reviewed by a team of scientists, expert in the field or expert in the molecule. And you will get a very well-informed feedback about why your proposal has been selected or why your proposal has been declined. And we spend a lot of energy with the team to really make sure that you get a clear feedback if you are not selected as a winner. So here, let me give you an example of the last molecule for collaboration that we place beginning of this year. So it was a RIPK2 inhibitor, so a kinase inhibitor. And here we are clearly looking for novel disease treatment. So the basic idea would be we would provide you this compound if you provide us a nice idea for repurposing this molecule. You have, of course, much more details on the website. Each time a call is placed, we give you also our priority list for the disease that we are interested in. But again, we are open to receive any type of proposal. Each time you have a bit of description of the molecule and the properties of the compound, and also a little bit of the background of the target that we are considering. The good example here with RIPK2 was a big success, I think. We received 84 proposals from 28 countries. Currently, the team is under evaluation. The proposals are under evaluation by a team of specialists. We are close to deliver the first outcome to the winner, and we will send also decline messages very soon. In the case of molecule for collaboration, you will have access to many important things. The first one, of course, you will have access to the compound to perform your experiment. You will have access up to 200,000 euros. We are a bit flexible here. It depends a little bit on your idea. And also all the knowledge of the target that we have acquired after many years of drug discovery efforts within Boehringer Ingelheim. So if you are a winner, you will enter into a joint collaboration between Boehringer Ingelheim scientists and you. And we are very proud of this because this is really making a difference. It's not, again, a partnering exercise. It's a real joint collaborative effort to, at the end, achieve and identify a new treatment for a severe disease. With this, I am done. I will just explain why we have launched these two initiatives, and then I will give the mic to Marcus. The first two initiatives are really here to understand better certain complex mechanism or disease mechanism. But of course, also, we would like to push projects in our pipeline with your help and your support via collaborative efforts. So we target projects which can enter into our portfolio in the early stage and then progress it together until we have a candidate. So I'm done for the first molecule to order and molecule for collaboration. And now I give the mic to Marcus for the rest of the presentation.
Excellent. Many thanks, Florian. So many thanks also to you, Luciano, for giving us the opportunity to speak to you this afternoon. It's really highly appreciated indeed. So that is basically the status that Florian presented to you. Until now, it was the situation. Just let me check. So yeah, that's me here. Just once more in a nutshell, what's the situation? How we actually launched the portal in 2017, and we gradually added more and more molecules to the portal to the rich kind of portfolio that you see today. And actually, maybe we should also add, we plan to add more molecules to it. We started with about 20 molecules in November 2017. You've seen we're close to 90. And I guess we will actually reach the 90 threshold during the course of this year. So more and more molecules will be added over the course of the time. So why am I here today? I'm a molecular biologist by background. I have a PhD in developmental biology, and I think that's fairly important and also one of the ingredients of success of opnMe, because we're doing kind of peer-to-peer conversations, i.e. to scientists who are either within our discovery research departments within Boehringer Ingelheim, but then also on your side, where you're either working, as Florence said, from an academic setting or from an institutional setting, larger institution, or even from startup or even pharmaceutical industry background. It's really very important that we keep the science that drives basically the innovation moving forward. That's actually what Boehringer stands for, but what we are also very keen from the opnMe team. What really has been important also that from our end, especially the pharmacologists, while they were really excited to see all these very good proposals around molecules that we put up from our discovery research pipeline. At the same time, they were also interested to also place their questions, pharmacological questions, on our pipeline, on the portal just as well. And that actually gave the birth to our Open to Expert program, which we introduced in the beginning of 2020. By sharing these pharmacological questions, we share precisely formulated questions addressing very specific questions from our discovery research organization with scientists across the world again, and ask them to come up with novel ideas how to address this. In order to help them a little bit, we provide corridors, if you may want to say, in scope and out of scope criteria for the solution space that provides a little bit, if you may want to say, the boundaries of the solution space that we potentially expect. But we really, and my colleagues are really excited for all these innovative ideas. In fact, opnMe through this has actually evolved into, I would say, a low threshold kind of approach for external experts to approach Boehringer Ingelheim, because historically you can imagine, classical business development or external innovation over the course of years started to focus and zoom in on large centers of excellence. Say, for instance, I don't know, often, focused either on the west or the east coast of the United States, and then focused on a couple of European centers as well as Asian centers. I think with Open to Expert, we have much more the chance to open this up and allowing other experts, and there are many, and lots, and most of them are actually not on the classical radars of our colleagues in external innovation, and allowing them to provide their opinion to certain questions as well. And that's what it makes so exciting. As we said, we launched this 3 years later compared to molecules for collaboration and the molecules to order, but it has even become more successful since then. So by now we've launched more than 35 questions. We received again more than 1,000 proposals from 65 countries in total. And this gives a little bit the overview where the countries coming from. And as you can see, Italy is here a very strong contributor of proposals, which is actually nice to see. And I assume a little bit, that we may have a bit of an Italian emphasis in terms of the audience. So this is definitely something that we have seen and noted over the course of the years, that there are many scientists from Italy or were based in Italy actually, who actually participate in our calls, which is actually something that we really like to see. The range of questions is very broad. And so for today, it's not our mission, to go through all the 37 questions that we brought in so far, but just rather providing you a glimpse about the breadth of type of questions that have been launched in the past, but also providing a little bit of an outlook. Most of the questions that we've launched are focused around human diseases, but we had also already on the portal questions that came from our colleagues from animal health. Some of you may be familiar that Boehringer Ingelheim is not focusing on human health, but animal health alike. And some of the questions that we did previously were also focusing on animal health questions. So addressing veterinarians, but also those who think, their disease model may be fairly well suited for an animal health situation as well. For instance, we had questions about equine insect bite hypersensitivity as an example, or looked into the very specific form of endocrinological issues in horses, which are again very different from the human situation. Anyway, so this example that we picked here has been a recent project. Again, gives you a little bit the idea in which direction it may come from. This obviously came from our colleagues from cancer research, which are based in Vienna, and it's about improving penetration and retention of biologics within solid tumors, because the observation has been that monoclonal antibodies that tend to bind to the surface of cells, and therefore also probably tumor entities, never really reach full efficacy due to the fact that they've been really literally sticking to the surface, and therefore never have the chance to migrate, I call it now, or find a way towards the interior of a tumor. And so this has been quite exciting. The evaluation for this is currently ongoing, but meanwhile, there have been 2 teams, I think with 2 runner-ups that have been selected, and we're currently in discussion to set up the conditions. So how does it work is within a limited period of time where these questions are available on the portal, we invite for questions, we invite for research collaboration proposals from scientists across the world to address the question that we bring up. All proposals that have been submitted are reviewed again by an internal jury, and if they are interested, our colleagues, they will be actually we reach out to them for initially non-binding conversations to meet the team a little bit more, and in case there's sufficient interest on either side, we would then set up bilateral research collaboration proposals with the teams. And as part of this research collaboration proposals, the teams would get research funding to pursue the research that they have proposed as part of a collaborative approach. So this first question was probably more from a technological angle, but there's also topics that are much more focusing on specific targets or signaling cascades, if you may want to say. And this particular question is currently still running until beginning of April. It's for a molecule called anterior gradient 2 that plays a role, among others, in lung fibrosis. But in terms of really understanding the mode of action, we were actually very interested to see whether scientists actually have suitable models in place that may prove the role of AGR2 in these very specific forms of lung fibrosis. You can see the calls are usually active on the portal between 2.5 up to 3 months, and during that time, scientists have the chance to basically come up with the proposals, as I mentioned before. Another very recent one has been now again focusing on the fibrosis. But here the idea is, the question has been, how would you leverage novel spatial and multi-omics to investigate mechanisms driving fibrosis suitable for computational analysis? With this call, we acknowledge that spatial multi-omics can be seen really as the next frontier in sequencing-based method. Transcriptional approaches have been very much established by now, but really the ability to integrate multiple layers of information from epigenetics, RNA, protein level, from the same tissue, and is really the next level. And it would be really interesting to have a deeper understanding. So we here invite research collaborators with shared interest in the field of fibrosis and expertise in spatial technology to investigate on this exciting topic with a potential for new entry points for the discovery of novel therapeutics against fibrotic diseases. This we just launched last week. It will actually be live until mid of May. And again, within that period, you have the chance to come up with research collaboration proposals. As you can see, the collaboration funding that you can actually ask for the respective questions varies a little bit, but usually it ranges between 200 and 500,000 euros per funded opportunity that you can find out here. And the QR codes that can be shown on these pages, you can use them, share them, take pictures with your smartphone, as Florence said, and should actually directly lead you to our webpage. You know, maybe just a quick word on our fifth pillar that we want to plan beginning the launch on opnMe as well, which is called TechMatch. You know, we've learned what we experienced is that we have more and more pharmacological questions on there, and as you can see, some of them have a slightly more technological focus, and others a little bit more of a biology, translational focus as well. And in order to make it a bit easier for the external folks to discriminate between these two types of, if you may want to say, open-ended questions, we want, moving forward, we will group all technological questions under this TechMatch pillar, whereby the translational and pharmacological questions, they actually continue to reside under the open to expert pillar. And that's, you know, what we're going to do. And, but again, you know, you welcome actually to join each of these pillars and submit your research collaboration proposals. Over the years, what we realized is that actually in many instances, there have been participation from scientists from all seniority level, but we actually observed again and again that there have been junior scientists who just basically at the starting of their professional career who actually interacted with opnMe as well on a regular basis. And we can even understand this because, you know, as Florence said, the molecules are free of charge. So there's not a big interdisciplinary, intergroup or departmental discussion required before certain audits can be placed or submissions can be done, because it's a bit the no strings attached approach. And therefore, in many, many instances, the original submissions have been done by junior members of the team, and then only later we actually met the real PI as we then progressed forward in discussion with them. But what we also observed is, in rare instances, actually, when we launched projects and later just started a follow-up, that we learned that meanwhile the scientist had joined as a colleague within Boehringer Ingelheim. And often we only learn them through the external follow-up. So we realized, hey, that's actually is quite interesting, not only to increase our academic and scientific network in general, but maybe also to find experts to fill in open position within the Boehringer Ingelheim research teams. And so we that led actually to the creation of one of the latest pillar, basically, that we launched last August, where we thought, you know, so why not opening this and opening actually a postdoc grant opportunity through opnMe, which will allow, in the end, postdoc candidates across the world to come up with great innovative ideas, again, for questions that we place on specific pharmacological or therapeutic area specific topics, and come up with our own innovative idea how to address this question. And the beautiful aspect about this is, if they became selected, they would work exactly on the proposal they have suggested. And at the same time, because that's now is also allowing them the opportunity to enter a pharmaceutical company, and if it's only for a temporary period of time, is to join our scientific teams at one of our 3 research sites, either in Biberach, which is in the southern part of Germany, in Vienna, in Austria, or in Ridgefield, which is about 2 hours north of New York City on the east coast of the United States. And the first question that we launched last year had been about retinal diseases or retinopathies. So here we asked for innovative cellular models to investigate the pathomechanisms underlying retinal diseases. And we specified this a little bit further by saying that we particularly were interested in diabetic retinopathy, age-related macular degeneration, or Stargardt disease, which is a rare hereditary retinopathic disease. As you can see, is that this call was open until and again for about 3 months or so, and got lots of really nice traction here. The job offer was exclusively offered via the opnMe portal. It allowed to access a 2-year position within Boehringer Ingelheim with a possibility to extend by another year. And the idea, as I just mentioned, to apply with their own research proposal addressing a relevant scientific question from the field of our strategic focus here. And in this case, the postdoc would move over to our research sites to Biberach, which is, as I mentioned, in the southern part of Germany. In fact, the gentleman displayed on this picture is Stefan Kreiderweiss, who is actually the mentor of the postdoc that we eventually selected. Maybe also a little bit in the statistics what we did, you know. So also you may ask yourself, my goodness, how would I've been actually able to find that opportunity if there was something, and I don't check the portal on a daily basis. Indeed, you know, so we you would be able to find us either on Google, on LinkedIn, ResearchGate, Nature Careers, and lots of other scientific channels that actually scientists using as part of their scientific exchange, etc. And as you can see, overall, more than 33,000 views that the page we basically obtained within the time when the call has been open. Interestingly, and I think Florian mentioned this earlier, on average for our collaboration proposals which lead to bilateral collaborations, we obtain about 40 proposals for our open expert calls, and actually about twice as many for our molecules for collaboration calls. Interestingly, for the postdoc program, we received here a lot less applications. So in this case, for the very first one, it had been quote unquote only 7. But what was nice is that we saw again saw the typical spread of application that we normally see as part of a crowdsourcing open science approach, i.e. a wide spread of countries. So the 7 applicants came from 6 countries in total. There had been only 1 country where we had more than 1 applicant. So that was actually quite nice to see. And what we also saw that, and I think that's in the end the rate limiting step, it was actually twofold. First of all, the subject of retinopathies is probably an indication which does not see so many specialists working on that area. So that's the first aspect there, because we previously, for instance, launched a call on age-related macular degeneration, which actually was able to attract 14 proposals in total, so also below the average that we've seen before. But I think the second aspect why we actually saw that there's less likelihood for people to come up with their own proposal is, of course, that here we're talking about a job opportunity at the end, and people have to basically come up with the notion that they will move to one of our research sites, and not everyone is ready or at that exact stage of his or her career to make that move, basically. And then collectively, that may further shrink down the number of people that move forward and would be applicable to it. What was beautiful, of course, that the 7 who move forward were really experts in the field of retinopathy, and they brought forward very innovative ideas how to move forward with this. We had very nice scientific discussions, and actually it was then interestingly, as part of the scientific discussion, that the team in BBRAF very quickly zoomed in on one candidate who was invited for an interview date just before the holiday season, before Christmas in December last year. And the beautiful was then also during the same week, then everybody agreed that this should be the candidate. An offer was made in January, and meanwhile, the winner has actually accepted the offer and will move over to BBRAF. And in fact, he did not come from Germany. So it was a bit of a cross-country move, and maybe also saying that a little bit because Boehringer is actually much more international than I actually thought when I first joined the company. Well, my background is German, but you can see Florian is, for instance, French nationality, and the teams are very diverse, and our language is pretty much English throughout the time. And I'm not even sure how close you follow actually Boehringer Ingelheim, but the overall head of the innovation unit, which is basically overseeing basic discovery, research, and development until what we call the proof of clinical concept, is now headed by Paola Casarosa, and she's originally from Italy. So that may be actually interesting for you as well. Anyway, so altogether, we also wanted to understand a little bit actually in which way we impact also the scientific reputation of Boehringer Ingelheim, because Boehringer Ingelheim is not fairly well known, because I think the reason is partly because it's not a stock traded company. It's still privately owned, surprisingly, by a family who actually comes out of Ingelheim, hence the name Ingelheim. It's the name of a town, and their surname had been Boehringer. That's the reason Boehringer Ingelheim, that's why the name came up there. But there are other, like also in Italy, there are famous examples like Chiesi, for instance, and also still a family-owned business, basically. We wanted to understand in which way opnMe helped overall to increase the reputation of Boehringer Ingelheim, the scientific reputation. More specifically, we looked actually at all these aspects here: leading open innovation, long-term relationship, and best partner. And maybe it sounds a bit like boasting, but we did fairly well across all these categories. And we were able to see if people interacted with opnMe, they also overall had a much higher opinion about the company as a whole. And maybe we should also say, you know, so there's not so much about open innovation in general. Boehringer Ingelheim is, of course, not exactly the only company who are pursuing open innovation or science projects as well. And Boehringer has also not been the first company in this field, and this may trigger again some interesting discussion as part of the discussion as well, why Boehringer went into this, etc. And of course, there are a lot of public-private partnerships as well, and Florian mentioned that very briefly, so maybe there are some questions around that as well. Maybe to wrap up a little bit, and many thanks for having followed so far, is, you know, so opnMe, since we launched it in November 2017, has been a fairly successful research initiative within Boehringer Ingelheim, with participation from more than 70 countries. We're probably one of the largest initiatives by now within Boehringer Ingelheim. You know, so, you know, on month by month, we have more and more registered portal users now, and meanwhile have reached more than 5,500. It's really intriguing to see that we have received more than 2,000 individual orders by now, with a shipment of more than 6,500 molecules, meaning per order on average we receive 3 molecule orders, and most of them actually come with negative controls, which is nice, and which we also encourage to do, because in many instances when you talk about biological concept, the worst is when you use non-selective or not well characterized tool compounds that are not backed up with negative controls. You may very quickly misled by quasi-positive or false positive results. You know, the research collaboration project that Florian introduced for Molecules for Collaboration and the Open to Experts program has been really, really successful, again, with more than 2,000 research collaboration proposals, making, and I have to be frank, this program highly competitive. But, and I think that's really is the most important thing, is the proposals that have been approved are by no means within the big well-known centers of this world that you would always list if you ask, you know, where you would actually expect science is done. But we have actually many I would say spots in the world and teams that we've been able to identify that were not necessarily on the center spot of classical business development. So it's actually really quite nice to see also more than 120 approved in total by now. And then last but not least, the publications. Florian mentioned that that's something that actually is, again, very, very nice. Yes, so in summary, I don't know, Florian, maybe you want to even take over now and just maybe sum up and then we open the room for questions a little bit.
Thank you very much, Marcus, for this very nice presentation of the last 2 pillars. Just in few words to conclude. So it was first a very big pleasure for us to introduce to such nice audience our 5 pillars. So the molecules that we offer for free for your research purposes, or the molecule for collaboration. The last 2 or 3 initiatives, Open to Expert and Open to Talents, with a bit more data in the coming months for Tech Match. So today we have quite a lot of registered scientists. I hope to see you register very soon on our platform, and you are very welcome to send us any question you have on the Contact Us formula. With this, I would like really to thank you for your attention. And I think we can open now the door for any questions you have. Thank you for your time, and thank you for the occasion and opportunity to present opnMe.com.
Thank you very much to both of you. A very, very clear presentation. So I'm sure now there are, I'm sure, some questions. I see already one in the chat by Visnia. By the way, hello Visnia, I hope you're well. And you know, very concrete. I mean, which is the way to start? I mean, where are the forms? So if you can please clarify further in practice how to start for a researcher who is interested.
That's right. Not sure whether you can actually see my screen. Can you still see it?
Yes,
that's right, because that's actually is the portal. Because, you know, so we can make it very straight, because if you were interested where to find the individual application forms, they're actually within each of the projects, actually, you know. So you know, so the Open to Talents program that we just basically introduced is about retinal diseases, basically is something you can actually still download the job offer. this solution, we hired the postdoc, as I mentioned. That's the reason why you cannot actually download the application form in this sense. However, we currently plan to launch the next postdoc grant call end of April. We're aiming for April 22nd to be more precise. If you wanted to then just come back to the portal, I cannot yet reveal you what the topic is about, but actually, you know, this has actually attracted quite a lot of internal interest internally, so it's actually quite nice. For the Open to Expert calls, maybe that also a little bit, just to give you here a bit of a glimpse, you know, how this works is, you know, I'm not going into this we only launched this week, but let's take this one, the spatial multiomics project that we just launched last week. You can see already within 1 week 5,000 views, which is very nice. You can actually click on the read more button, and here you actually can either download the PDF profile of the question, so you can take it with you, you don't need to have it really on this, and here, and that's how it would actually look like, also a little bit like on the for the other ones. This gives you basically the answer template, and then you can basically start filling this in with your proposal and take it from there. So that's a little bit how it works. So it's really straightforward, actually. That's actually quite nice. Yeah, so very easy. Hopefully, therefore, Wisner, this has helped to answer your question.
Thank you very much. In the meantime, I encourage all the participants to ask any question. I mean, always questions are useful to clarify some points, you know, that maybe they are clear for some of you, but not for everyone. Maybe as a general question for me to break the ice, Florian and Marcus, again, you've been very clear, but which are, you know, if you have to summarize the main challenges that researchers face, you know, because in my view, the idea is really excellent. I mean, companies like yours, I mean, you have a lot of molecules that's, you know, somehow are there sitting on a shelf, you know, so you provide them to researchers. So the idea is fantastic, but my experience is that, you know, even behind the best ideas, usually there are some issues, some difficulties. I mean, which are, you know, let's say the feedback, based on the feedback you receive from researchers, which are the main issues they face?
Yeah, maybe I should start, and then Florian can maybe chime in. Probably, you know, so issues depends probably at which stage of the career a scientist really is, and also it's probably a little bit depending on the geographic location as well, where the person sits. I mean, I think there are probably, if you may want to say, certain inflection points in at least a classical academic career, and it probably starts, you know, at one point in time, the person will need to decide which strategic direction he or she would like to pursue, whether that's actually a classical academic career, a career at an international institute, or indeed entering the pharmaceutical industry. And you know, across all these inflection points, you know, so there are probably different things to consider. But let's assume now, zoom in a little bit closer to opnMe, and therefore let's assume it's either international research institute or an academic center, let's assume in Italy, for instance. Of course, then then very quickly always the topic comes up, you know, so first of all, where do I get ideas moving forward with my field of study? And the second, therefore, the aspect of network comes up. Networking is probably a very big topic, because nowadays, if you're not networked, I guess, you know, whatever field you're pursuing, your research may not really lead to really innovative insights, because it's often done collaboratively. And the second aspect is, of course, the aspect of funding as well. And in both instances, I think these are probably motivators for scientists to reach out to Boehringer Ingelheim. One is, of course, you know, really the networking aspect, because it's always nicer if you find allies, if you may want to say, in your quest to pursue certain, well, in your fight to help patients in the end, you know, so to come up with innovative scientific ideas for patients that may be a hypothesis that you've been working on for years. And we all know that this discovery process is not linear. Yeah, it's actually characterized by multiple failures and coming up with new ideas and new approaches and new angles, looking at the disease all over again, sometimes giving up, focusing on another disease, coming back to the first disease, and so on and so forth. It's really endless, you know. So and I think therefore then sometimes it makes probably at one point in time potentially also sense to reach out to a pharmaceutical player, somebody who's doing active research in the field as well, because when it comes down to the often characterization of certain genes or targets, it would be good to interrogate with the function of that gene, and then to have a partner in place who may actually have a tool compound in place which allows to interrogate that signal pathways in order to validate the hypothesis is often the last bit that you need for a very good publication. And this may be in itself the need to publish the next topic, you know, that you have. And then at the end of the day, it's probably also funding, because, you know, funding at universities these days is limited in many countries. And so therefore, there's really the need to look for alternative approaches. And, you know, the opnMe portal, in my opinion, allows a forum, yeah, to exchange around very specific topics. And if there is a kind of a match, if you may want to say, that then also leads to the ability to fund these topics of a course and to move and progress certain topics together a little bit. So that's how I see it a little bit. Florian, I'm not sure whether I've answered it, but or whether you have additional ideas from your end as well. Maybe you can also answer from a chemist point of view, yeah, so which is probably also interesting.
I would say, yeah, thank you, Marcus. I would say indeed there is, maybe Luciano, to answer to your question, something which is really missing when biologists are performing experiment is the PK, the pharmacokinetic aspect, which is really quite often underestimated. Meaning, in general, either you push the dose like hell and you don't really look at the PK/PD, or you are quite often, and we have experience with a lot of academic partners in now discuss this topic, you are not covering the target. So I think the PK studies are really something missing, or at least the thinking about PK, you know, how much do I need to cover the target? What is the IC50 of the target? What is the free exposure that I have? And all these parameters are extremely important for a successful in vivo testing in particular.
Thank you. Very interesting. So again, I encourage all participants to ask questions.
I see, Luciano, a question about the molecule from Mohammed. And yes, the question is about, okay, are the molecules that we plan to share distinct from the one on zinc or PubChem? Very good question. To be very clear, before publication on our website, these molecules are not known. So either the free molecule and even more the molecule for collaboration, none of them are published, or very rarely they are published. For sure, the molecule for collaboration are not published because the goal is to keep, of course, the IP for the collaboration. So the patent is most often not filed when we will start the collaboration. So the structure is not known for the molecule for collaboration, and they are new for molecule to order. And here, if I even go a step further behind this question, our compounds are in general very high quality. So they are ready for in vivo. They are super selective, super potent. It's in general not the one you find in PubChem or even in Campbell, for instance.
Certainly the quantity is always enough. I mean, do you have always enough amount? Because for some studies, you know, we need quite a lot. That's not an issue usually.
We never really we had one phase where one of the compounds was very difficult to make and extremely difficult to get large amount. But today we have a commitment from the head of chemistry to provide the synthesis for all of them. And we have always a stock for big studies. Just for fun, because I love this figure, we have shipped up to 1 kilo of compounds in the Texas University. It was for formulation studies. It was, of course, not for in vivo studies, but yeah, we have stock and we have the commitment of the head of chemistry that we can continue to synthesize a molecule.
And the stability also is usually, I mean, of course, you know very well these molecules. So I mean, during the shipment, etc., you guarantee that, you know, the molecule you finally study is the one that is described in there, no degradation. Okay.
Of course, it's a very important point. So all these compounds are very close to clinical validation, clinical stage. it means that in terms of stability, they can be stored even at room temperature for a couple of days without any change at all. In fact, we know that most of them, you can store them forever in the fridge. So if you do not open and close under oxygen and water, these compounds are super stable.
And since I mean this, I really thank Marcus for referring often to Italy, but the audience that we see online is very international. So I'm Italian, very proud to be from Italy, but there are people from all over the world in this webinar. So my question is, are there difficulties for some countries, to participate in this program, or basically you're open to all the world? How is the approach?
The compounds follow, in fact, the rules in the US, because we are also a research organization in US. So we do not ship compound to the list of embargo countries by US. The list is very limited. It's only a couple. We have only one challenge currently to ship compound in China. This is the only countries where it's difficult, but it's not due to the nature of the molecule. It's just due to the paper and the paperwork that we have to do with China. But it seems that we found maybe now a solution for this. But otherwise, in Europe and in US and in Africa, except if the country is on the embargo list, we have no limitation of shipment.
That's a pity, because I mean, we don't want to start this political discussion, but usually in academia we are very open to all countries. But we understand that for companies it's more difficult. But usually, for me personally, I publish with basically all the countries in the world. But I understand, that for us academics we are more free. I don't know, Marcus. I think you wanted to jump in.
Yeah, it's right. So just maybe on the amount, that one received, because, with the kilogram, so that maybe some of you may ask the question, what's the standard actually amount? So initially we really start with amounts that are really generous for, I would say, in vitro or cellular assays, or the start of a vivo analysis. So they receive usually 5 milligram of the actual molecules and 2 milligram of the negative control. And that often also means, of course, in vivo study, you normally require more. And then often scientists reach out to us. So I think something that, there's an excellent team. It's not only Flo and myself. So the team is nice. And, it's actually quite interesting to see that within Boehringer, lots of the contribution to the opnMe project is on voluntary basis. That shows also how much also our scientists love it. And they spend basically a little bit of their free time, if you may want to say, or spare time they have, to the portal. And there's in particular one colleague, that is in my mind, who's really dealing with all these incoming requests for larger amounts required from vivo studies, which is fantastic. And we really have a very nice follow-up. In fact, that's, for instance, how, Florian mentioned that seminar that we were recently, really last week, providing, so often we really start to meet the folks when they have findings, and we really help them. I mean, Laura Zimmerman, so Deepa Ghosh, so both of them receive much more than just the molecule eventually, so because we really help them in order to overcome the hurdles throughout the experiments then later as well, which I think was actually quite nice, which is good. Also almost in-kind like.
I see also a question from Adrian, and indeed I need to clarify a little bit my statement, Adrian, regarding what we mean with molecule to order, and what does it mean when I say not ready for human clinical trials. Let me be clearer. The compound we share has not been qualified for human application. So it means that the tox has not been made. So we have no idea if they can go to human, which means by essence, it cannot be tested in human. We have a perfect understanding of the target. We know exactly that the compound is doing something on the target, and we know the potency on the target. So all of this in vitro work is very well understood. But the compound cannot be used in human. It's simply forbidden because we do not have done any regulatory work or any tox work. And to answer to the second part of your question, yes, most of these compounds are stopped molecule. The project has been stopped internally, most often for strategic reasons, fit with our strategy or our disease map. Sometimes also because the compound was pushed in different assays. And the compound did not answer to the question we had, and then the project was stopped. But it doesn't mean that the molecule is bad. The molecule in general is good. It's also simply us do not understanding the biology properly, and then the management decide to stop the project. But it doesn't mean that the compound is not doing what we think it should do on the target. I hope I clarify, Adrian. If not, please ask me again.
Florian, I don't know, Marcus, if you have anything to add.
Yeah, maybe just, I see from the answer this just tool compounds. I think maybe we should really clarify this as well, because there are indeed open innovation initiatives from other players in the pharmaceutical industry who also offer clinical trials as part of open science projects. But we on purpose have not embarked this way, because first of all, we think, so in terms of providing really benefit, in terms of generating new hypotheses, proving hypotheses, and moving forward with cool ideas, I think it's very important to start early on. On the other hand, often, so nowadays, think about humanized models that one can just as well employ, because, the molecules that we do, they have, of course, often they're already created against, in the end, with the notion ultimately to work in a human context. So they work very well in rodent, but they work also against humanized cell lines, for instance, or human organoids, etc. And so then we very quickly come into this translational aspect. And I could imagine that this actually could trigger still lots of interesting ideas that one would like to pursue. And if it is about finding new biomarkers or stratification markers to understand to at least come up with a hypothesis which populations may eventually benefit from certain drugs or interrogation with certain pathways. Yeah, very good.
Other questions from the audience? Maybe one point, maybe we can elaborate a bit more. You already mentioned, clearly, Florian and Marcus, but let's go back to the point of searching the molecules. In my view, that is key, because, of course, chemists, they know very well the formulas, etc., but not necessarily biologists, pharmacologists, they know all the details. And also sometimes, you search for an application, but not necessarily, you want to just select a specific mechanism of action, because otherwise, of course, yeah, you can do a very predictable search. If you, of course, know you want to search for a specific inhibitor of an enzyme or something, that's really easier. But sometimes you want to have an effective molecule in a certain model, and you don't know exactly in the beginning which mechanism of action. So my question in general is, are you going to use or you're already using artificial intelligence maybe to improve the search, let's say, efficacy? Because that, I think, would be interesting to maybe receive also some suggestions. Let's say you want to find a specific molecule for a specific therapy, and then maybe the algorithm can suggest some molecules maybe you don't think about. What is your...
In fact, we already discussed this topic a few months ago when we met the first time. I think, Luciano, it was already a good idea. In fact, we had a brainstorming recently with the team, and we are discussing and we are thinking about this. So the idea would be to have a much more performing search engine on the website, because today, if you use the website and you know what you are looking for, so a certain target, you can type the name of the target and you get immediately the molecule. So it's easy, or the call. Of course, if you target something like, what are the molecules for inflammation? The search engine will not help you. So yes, we are trying to implement LLMs to exactly answer this type of question. I am working in schizophrenia. Do you have molecules which could play a role in this disease, for instance? Surprisingly, it's not so easy, because there are quite a lot of complex technology problems to solve and legal and license. But yeah, the technology is under scrutiny, and we are working with our IT colleagues to see what is possible.
Yeah, I'm happy that our discussion a few months ago was somehow useful. I don't know, Marcus, also please feel free to jump in at any time.
Yeah, I mean, artificial intelligence or the use of machine learning, you know, so in both biology and chemistry, I think is currently kind of almost the next frontier and will probably change again the field completely over the next couple of years, you know, because in terms of, you know, it starts actually with finding information, but it's probably also using computational approaches in order to come up with new hypotheses. I think that and the strength of really computational biology approaches, I think we're still at the very beginning here. I think that's actually is very nice. Do actually computational biologists using opnMe? I think so very much, because one of the publications that we showed on for these top molecules actually was a computational work. And very recently, actually, we also made for the very first time data available via opnMe, and it's actually a little bit hidden, sorry, not in the news sign-up, but actually in the news, apologies, where we actually make, now it's currently still a bioRxiv submission only from colleagues of us, where we make actually certain data, so structural variants available via opnMe, by which you can actually download these imputed data. Actually, it may be also something of interest to you to read it if you're in this field. And you know, moving forward, this may actually be also quite interesting for some of you as well working in the field. Indeed, I just realized you can actually easily type this in. So so that may be really something. Let's see how this all evolves, you know. So but there's actually a lot going in there. So it's actually quite nice. Yes, very good. Any other questions? And many thanks.
So yeah, to just to elaborate more, I mean, again, on this topic of artificial intelligence, I think is very powerful, because what I'm reading also, I mean, saying toxicology, for instance, you can actually go back and, you know, dig about some possible, you know, toxic effect of compounds that are related to, you know, some, or screening the literature. I mean, this algorithm are very powerful, let's say, to read in a more efficient and faster way so many articles that humans, of course, cannot do, and come up with some suggestions. And at the end, you know, humans are key in making the final decision. But, you know, this algorithm can give a very interesting suggestion that maybe, again, for humans would be difficult to elaborate in a fast way. So it's wonderful development.
It actually just triggers another idea you had, and I was thinking about this the same, because ultimately it all depends on the quality of the data and whether they are annotated correctly. And what's really is important, and just try to find it somewhere, maybe here. Is something that we did. In the end, we have actually provided the selectivity data for all our molecules on the portal, and that you can actually download them for free. You can actually get them all. Selectivity data means the molecules, these are tool compounds, as I said, they have a certain name and therefore a certain target. And most of them are highly selective, i.e. they really literally hit only one target. So they are already very well characterized. But it's worthwhile, for instance, as an example for text mining approach, to download this data, because it's standardized across, we're working here together with the Eurofins. Some of you may have heard about this company, who testing them against a typical panel of 40 targets. Normally it's actually a safety panel, basically, but it's highly useful also for basic research as well as, and then you can actually select, you know, so because it could be fairly well that by accident one of those compounds also hit a target that you may actually be interested in, and I think this could be fairly well be explored through a text mining approach. So I would very much encourage you. There's probably so much more into these opnMe data that you can see, and that's actually available for all the molecules that we have here, and also for the negative controls, by the way. So because it's very important to also understand the selectivity profile for these things. And I think that's very nice. So there's it's actually quite nice. This has been in place now for almost 4 years as well, and we adding these molecules as we add the molecules. So it's actually really quite nice, and another very nice tool that we can only encourage to use. So.
And Luciano, maybe one point about the artificial intelligence. I did the test recently. ChatGPT 4 was educated with opnMe online already, because opnMe was launched quite a couple of years ago. Of course, not the very last molecule and the very last call have been analyzed by the artificial intelligence and the algorithm, but at least ChatGPT 4 has seen opnMe. So if you have certain question, or you can get some feedback about opnMe, and maybe even address this as a resource for any questions. Yeah.
Interesting. Maybe again, we ask if anyone would like to ask questions, please put it in the chat. And in general, this is a big topic, of course. What about the negative data? I mean, if people try a molecule and it doesn't work, do you collect also this negative data? Because this could also be interesting to avoid to repeat experiments that maybe they already failed.
Mm-hmm.
So there is no strings attached with the compound, which means that, in fact, we do not force anybody to send us any data. Of course, if the colleagues, the researcher, has negative data about an in vivo experiment, for example, we would be very happy to listen to this and learn from it. But because there is no strings attached, it's rare that the user send us a feedback. They send us a feedback when it's positive.
Maybe it could be useful to try to find some incentives for people, you know, if you send back some even negative data, you know, you can find some way to incentivize that, because this is a big issue in research. You know, very often we try again and again certain things because very often, you know, there is a bias in publications, you know, towards positive data. And of course, so it could be interesting also to try to have some very concrete information of things that do not work, and so people will not try them again.
Mm-hmm. I think that's a very, very valid point here. Mm-hmm.
Any other questions from the colleagues online? Otherwise, we are going quickly towards the end. But again, it was very interesting, you know, Florian and Marcus, thank you very much for your talks. I think it's a very interesting project. So really, from my point of view, we will try to disseminate as much as possible these ideas and to continue these collaborations. Okay, so I give you maybe one, if you want to say one final word, Florian and Marcus, and then we close.
Just a big thank you, Luciano, for offering this opportunity. And again, looking forward to get some emails, interaction, and questions on our mailbox.
Very good. Same from my end as well. Many thanks, Luciano, you know, for having organized meetings. Many thanks to all participants for taking the time this afternoon or morning, wherever you are, or evening, you know, for having joined us. It's been a true pleasure, and many thanks for all the questions. Very good. Thank you.
Thank you to all the participants for being with us. Thank you to Menorca behind the scenes, that she did a lot of work together with Marco Gori from ConfNow. I mean, when we are there, of course, for us it's very easy. Everything is ready, but there are a lot of people behind the scenes working hard. And again, let's keep in touch for other possible collaborations. Okay. Thanks
Very
a lot.
good. Many thanks.
Ciao.
Bye-bye.
Bye-bye.
Ciao.
Thanks a lot.
Ciao.